The following segment is paid for by Preventative Diagnostic Center.
Well, if you are between the ages of 40 and 70 and are at risk for heart disease, you may want to consider getting a heart scan. Dr. John Pierce is joining us now from Preventative Diagnostic Center to talk all about the amazing scan that they offer. How are you, Dr. Pierce?
I'm amazing. How are you, JJ?
I am great. Thank you so much. Calcium score. What is it and why do we want to know about it?
Well, the calcium score is derived by, when we do the scan, we look at all four coronary arteries. And if there's plaque buildup that has been hardened, it's hardened with calcium. And so we're able to calculate the amount of plaque burden with the scan. So we can see if there's a score, and it's generally if it's over 400 or over 180 in one particular artery, we give the patient a call and say, hey, you should probably go in, see a cardiologist or your primary care physician, because they may want to do some further testing, like a stress test or echocardiogram or whatever they feel is the most appropriate test.
Yes, and before we move on to talk about who it is that is most at risk here, let's talk a little bit more about Preventative Diagnostic Center, a little bit about your history here in the Valley and this amazing scan you offer that it really is some very unique technology in our area.
Yeah, we have the Somatom Go Alt Pro CT scan. It basically measures the individual so we know what their density is, and we are able to, or the machine actually is able to calculate exactly how much exposure they need to get the highest quality images for our radiologist to read and get an excellent report back. So it's very unique.
Yeah, it is, absolutely. And the amazing thing at Preventative Diagnostic is that people can come in without a doctor's referral, correct?
Absolutely. So if people want to take control of their health, get that peace of mind, they can just come on in and we've got a few different programs to offer, and we'll run over those programs with the individual and they can choose what they want to do.
Yeah, and you are on South Tenaya Way. You can practically see the location from the freeway. I have been by. I had a scan done and it was very simple. I wasn't intimidated at all by the process. You never know. When you think of a scan, I think, in an old school way, you think of kind of being, projected into a tube where you get a little claustrophobic. Not the case with you.
No, it's basically a thin donut and you're in and out, quick like a bunny.
Yeah, you make it sound so easy. Let's get back to this calcium score test. Who is most at risk
generally,
for a problem?
Yeah, so the people that are going to develop coronary artery plaque buildup generally are the smokers, people that are diabetic and do not their blood sugars under control, hypertension. So if you have high blood pressure, you don't keep that under control. Those are generally the main areas that we see. So very rarely do we see somebody with a high calcium score that does not have one of those three. It does happen, and then I just kind of feel that for some individuals it's just poor genetics.
Well, it's a little intimidating, isn't it? Because we know hundreds of thousands of Americans have heart attacks every year. Sometimes it's a little, like the warning signs can be a little bit elusive, correct? Many people don't even know that they're at risk.
Well, that's true, right? So for most people, they have no idea that they're at risk, and then unfortunately, their first sign of a heart attack is the actual heart attack. So that's why doing the scan can give you some insight to the potential for risk for coronary artery disease or having a heart attack. And if you're at high risk, we will refer you to your doctor or a cardiologist, and they will do further testing and then sometimes intervention, or whether it be medications or some sort of procedure, but we leave that up to those experts.
Yes, exactly. Right now, there's an amazing opportunity, really a discount that you're offering for our viewers.
Yeah, we're offering a 2-for-1 scan. So generally one scan for the heart, just to look at the coronary arteries, as we've been talking about, is $599. we're offering this scan for 2 people for $125 total.
Wow, that's quite a deal. PD Center LV, guys, the website is right there on your screen. Check out this amazing opportunity to go down, get peace of mind with the folks at Preventative Diagnostic Center. They're located on South Tenaya Way.